afternoon and welcome. It's Dr. Bring again coming to you from Dublin Methodist Hospital. Just wanted to give you another weekly update here on the COVID-19 disease and some other things that we're seeing and questions you guys may have had over the past week. So the first question is, how have things changed here at Dublin Methodist? So our hospital census luckily is still fairly low. We do have a couple of COVID-19 patients within the OhioHealth system, but at this time, again, the census remains low. And again, to reiterate, we have been pretty intentional about this. Like we talked about before, trying to minimize the amount of outpatient surgeries and things that aren't as urgent. We're really trying to keep those numbers down. Some new things that we're doing right now is for all employees or patients that are coming in, or even family members, we are taking temperatures of anyone that enters the hospital just to make sure you're what's called afebrile or without a fever. And the reason for that is because most cases, as we discussed last week, do end up having fevers. So that's one thing we're really looking at, trying to avoid is unnecessary contact. We're still sticking with the social distancing as we had talked about before. And yeah, in the hospital, it's great walking around. There's a great sense of solidarity among the staff. We're all in this together. And, I think we're going to come out even stronger once this is all over with. So the mood and the optimism here have been great as well. The other question was asked is, for me personally, what are some things that I've been doing to stay safe? One, as you can see, I'm wearing scrubs. I haven't worn these probably since I was a resident at Riverside Hospital. Got these out, and the reason is when I go home, what I can do is take these scrubs off right away, throw them in the washer, and it minimizes my risk of bringing any of the the coronavirus home to my family members. And so that's basically one thing that I try to do. I take my shoes off outside the home, frequent hand washing here, and I've got my hand sanitizer with me always. I've probably washed my hands at least 50 times today. That's around 50. I know, it's only 3 o'clock. And so that's one thing just to keep in mind. Keep with the social distancing. I'm practicing that as well. I try to practice what I preach. Even when I go outside to do my runs, for exercise, I still try to stay fairly a good distance apart from people. Moving right along, I'm still talking about prevention, any drugs for preventing this. Unfortunately, we don't have a vaccine. I'm sure that's been big in the news. If you look, the vaccine will probably take about a year, maybe 12 to 18 months before it's really ready to be deployed out and given to a large population of people. And the reason for that is it just takes time. The virus has to be studied, and it takes time to develop the vaccine, do some clinical trials, and see how the vaccine works. So that could potentially take, like we said, about 12 to 18 months there. There's no drugs that I've seen or any medications that you can take to prevent this. I know there's been some trials about zinc supplements and vitamin C during active infection. So again, this is where it's so important. We always talk about what's the best preventative thing you can do. Wash your hands, social distancing. We always talk about good cough hygiene or sneezing hygiene, making sure you're coughing or sneezing into your elbow or a dab, if you will. I know it's my wife's a 4th grade teacher, likes to tell her students to do that. Just good hygiene habits. I think that's the biggest thing. And staying patient too, because I know about this time, it's been a couple of weeks now for the social distancing. It is going to be some more weeks to months longer. So staying patient and really coming together as a community is very important here. So the other question is we're talking about when are the peak cases going to hit Columbus or even Ohio. So we just had some updated data today given to us. They're really expecting this. So filming this on April 1st. They're thinking probably towards the end of April, early May is when we'll see our peak cases. So when we talk about peak cases, that's a reflection of infection transmission that happened 2 weeks prior. As you know, there's kind of that 2-week lag time, up to 2 weeks of when the disease can show itself. And so when we talk about peak cases, that really means at what point did the cases hit their highest number and their highest volumes. I will speak to this has been all over the news about how great it's been that Columbus hospitals are collaborating together, working together to come up with great solutions to help take care of Columbus as a city and also Ohioans as a whole. So we are very encouraged about that as well. So again, I think the higher numbers are ahead of us still, and we are starting to see a gradual increase. However, I do think that the drastic measures that had been taken several weeks ago, canceling these big events, could potentially have saved tens of thousands of lives. So that was fantastic that Ohio was on the forefront of that. So the next question is asking about immunity. If you do get infected, do you develop an immune response? I will say, and I'll see if we can put this link in the bio, there was Dr. Poland from the Mayo Clinic, who's a immunologist and virologist who studies viruses, did a fantastic job explaining this. It's about a 28-minute podcast if you can get a chance to listen to it. And basically, what he was saying is it's a novel virus. This is a new virus. All the information that we have is basically, over the past 3 or 4 months. And prior to that, we don't really know a whole lot about this virus because it is new. And so this is where, we always ask about, well, what are things going to look like a year from now? If we looked back at the SARS virus, the CoV-1 virus, this was the one back in 2002, 2003. That virus kind of disappeared, and the immunity kind of waned. If you look at the MERS virus, the Middle Eastern Respiratory Syndrome virus, that one, the immunity did not wane. So that was kind of a key point that came out of that discussion that he had there. And the new coronavirus, the SARS-CoV-2, this is very similar to some of those other viruses. So that's why it's so important to look at both of those. So right now we always look at, we've had coronaviruses being studied in humans since about the 1960s. We always ask the question of, can we be reinfected? And if you look at historically coronaviruses in general, we always kind of have these seasonal reinfections, as we call them. So it is possible. It very well may disappear, or as far as the immunity goes, it just depends on how this virus responds and how our immune systems respond. So I think that one's still a little bit too early there. So the next question here is looking at what needs to happen for the physical distancing guidelines to end. Going back to my previous point of understanding when did the infection transmissions occur. So with this, I think we need to look at, we'll know a lot more information in the coming weeks of when we think we've hit our peak cases. And then after we've hit that peak and the numbers start to come down, I think about 2 to 4 weeks after we get to those lower numbers, that's kind of when we'll hit that sweet spot of knowing, okay, can we kind of resume and get back to regular day-to-day activities? It's going to be very, very difficult to predict that. As you've seen nationally, there's been different pockets of cities that are getting hit harder than others. So I think for right now, the social distancing is so vital. It's so important. It is the right call. And so anything you can do to stay home, wash your hands, and avoid any unnecessary contact is probably one of the most important things that we know. So, once we get down to that low number of cases, what they're saying is at about 2 to 3 weeks, and then from there we'll kind of know if it'll be time for us to get back to our regular day-to-day life. The next question is really interesting too. Is I get asked this question a lot: is once the warm weather hits, will this virus taper off? At first, what I'll say is we obviously don't know yet because it is a new virus. When you compare things to like the flu virus, the flu obviously wanes in the summer and then ramps back up in the wintertime. So in the northern hemisphere, it is potentially possible that this new coronavirus could decrease in its infection risk here. However, we don't know that for sure. If you look at the SARS-CoV-1, that virus kind of just disappeared in about November of 2002. If you look at the MERS virus, there's still some over in the Arabian Peninsula kind of circulating around. So it's very difficult to predict how these viruses are going to respond to different environments. But I will say this virus is a little bit different in that it seems that it's a lot more highly infectious and obviously had a much more widespread focus than some of the other viruses there. So just some other things to keep in mind. There is a pretty strong genetic similarity to that first SARS virus from the early 2000s. And so just kind of basing it off that, my hope is that, the infectiveness of this virus will kind of decrease over time. Especially in the summer, the warmer months, a lot of times these viruses aren't as stable in warmer weather. And they're also a little bit more difficult to transmit among humans as well. So we'll know here shortly too as it warms up in Columbus. Some final advice, we always ask, well, what are some unintended consequences of this virus? I know personally, I've just from following people on social media, I've been so proud of our community here in Columbus about getting active and getting outside. I talked about the hashtag, the running is not canceled. I've seen more people outside than I have probably in years, which is great. Still maintaining that social distancing. I know a lot of gyms are closed right now, so there's a lot of really good online courses and classes I know that are free. YouTube. There's a lot of local gyms and businesses that are offering free classes as well. So definitely look into that kind of stuff. And also making sure you're still eating well. And I know that less frequent trips to the grocery store might mean buying less fresh produce, but try to avoid anything that's highly processed as much as you can. And really try to eat as healthy as you can. We talk about eating well, sleeping, and exercise. Probably the three best things you can do in this situation. What's unique about our office is that this week we actually did a lot of phone conversations. One thing that I noticed is even patients that are not necessarily sick, there's a lot more depression, anxiety, some nervousness, even some mild panic attacks that have happened as a result of this virus. And I think that that's where it's so vital to, rely on your friends and family, do some FaceTime, text messaging. I know there's like even virtual poker things that you can play. Do things to interact with your friends and family, electronically. And I can't state that enough. Humans crave social interaction. And so, to help minimize that depression and anxiety, it's so very vital that, you're really trying to stay engaged and interactive with your community as much as you can. This is, it's going to be a challenge. The next few weeks are not going to be easy. We all desperately want to get back to our normal day-to-day lives. But, in order to, minimize the risk of people that get, sick and minimize that mortality rate, I think, sticking with the social distancing is going to be vital. So just a couple more fun points from today. If you do have any more questions, like I said, we're happy to give kind of weekly or bi-weekly updates. And keep washing your hands. Keep doing it, Columbus and Dublin. As physicians, we're so proud of the community and the work that everyone's doing to stay home and playing your part in preventing the future spread of the new novel coronavirus. So we'll talk to you soon. Wash those hands and have a great week.